Hey YouTube, what's up? I'm back again after a long break again. Today, I wanted to talk about, I did have a partial thyroidectomy. That's partially why I haven't made any videos, partly because I'm just lazy and I just want to be home and relax and not do anything. But I need a hobby, so I just need to keep doing this again. So I'll just get into it. I wanted to make this video because when I was about to get this done, I was looking at videos of just people that have gone through it, because when you look it up, although it's very common, there's not a lot of people that talk about their stories. And I think just because it's such an easy thing to go through, but not really for me, because I'm crazy. I had convinced myself I was going to die. I was not gonna make it through surgery. I was gonna die of cancer, everything. So yeah, this kind of all started after I had my son. I was diagnosed with postpartum everything. Postpartum anxiety, postpartum depression. So yeah, I went to my 6-week postpartum appointment. I was already about to tell him, you know, I'm not really feeling normal. I know baby blues is like a normal thing to go through after having a baby, but I was feeling like really bad. This was happening before I found out about my tumor, which once I found out about it, it made it worse. I got to my 6-week postpartum appointment and my doctor took one look at me and was like, we need to order you an ultrasound because your neck looks, well, my thyroid looks very large. So I went to my ultrasound. I really didn't think they were gonna find anything. I don't know why. Maybe it's just like inflamed from just having a baby. He did diagnose me with postpartum thyroiditis. It usually causes like problems with breastfeeding, which I did have. I only breastfed for 3 months because no matter what I did, I could not make enough milk for him. I tried everything, which was making everything worse for me because I felt like I was failing him. So yeah, it was hard all around. So I went to the follow-up appointment for my ultrasound and he told me I had a very large nodule. I can't even tell you how upset I was. I just had a baby and now I have the possibility of cancer. As soon as my doctor left the room after giving me that news, I just broke down in tears. I cried the whole way home. I was very upset. I was a mess. So on top of just feeling like the worst mom in the world, I can't feed my baby. Just had a baby, so I'm just like feeling so and now I could possibly have cancer. Which really, I was having the time of my life, obviously. I mean, my doctor was very cool about it. He was like, I do not think it's cancer. You know, majority of the time, they are benign. Like, I'm pretty sure it's 95% of the time they're benign, if not more. But with anxiety, I convinced myself I had thyroid cancer. I had the worst type of thyroid cancer. And I was going to leave my baby, going to die, and I'm the worst mom ever. I feel like I'm saying it wrong, but my nodule was 4 centimeters at that time. So anything over 1 centimeter, they want to biopsy to make sure it's not cancer. It's just routine. That's just how they do it. And mine was considered very large already at that time. So yeah, he referred me to an ENT, which is an ear, nose, and throat doctor. They will call you with an appointment to get the biopsy done. And then from there, you know, we'll just see what happens. And then I got the call in September that I would be getting my biopsy in a few weeks. It was like the end of September. So it happened pretty fast, honestly. So I go, I was so terrified. I'm an idiot and I look up videos of everything. I don't know why I'm like this. So I was super scared and anxious and terrified for my life. It's called a fine needle biopsy. And what they do is first they ultrasound you to to get an idea, you know, where everything is, where they want to take samples from, like areas that could look suspicious that they could get the best samples out of. Don't go off of what I'm saying. Please do your own research, because I'm not a doctor whatsoever, but I am a Google doctor. I'm a Googler. And then they numb you up. That's the most painful part, honestly. It's just a little sting. It really did not hurt at all, but it's just uncomfortable because it's in your neck. And because it's in your neck, you kind of feel this pressure like in your ears, like in the back of your neck. It's a very weird feeling. It's really scary, but it's not. Once you look back on it, like now I'm like, oh, like
biopsy.
Like, I could do it again, but I won't. Hopefully not. I'm not sure how many needles they used on me, but they just poke in and out to get little samples throughout the nodule. While they're taking the samples, they tell you, like, please do not swallow, because obviously they have this needle like going through all this tissue into your tumor. And I swallowed. Thankfully it didn't hurt or anything. They were just like,
please do not do that again.
It was super easy. I worked myself up for nothing, literally nothing. And they told me, oh, because I got this done, I think on Monday. They're
like, oh, by Friday or next week we should call you, like beginning of next week.
I didn't hear back for 3 whole weeks. I was a mess. I was crying every day. Every day that went by, I was like, something's wrong. Like, obviously it's taking too long. They just don't want to call me and give me bad news. I was just crying every day, driving my fiance up the wall. That poor guy. Oh my God, that poor guy. So eventually, towards the end of the 3 weeks, we were just calling every day, like, hey, is there any update? Please, like, I am going crazy. I am losing my mind. Please, like, as soon as you know anything, please call me. I don't care what time it is. Just call me, because I cannot sleep. I cannot do anything without freaking out about this. I know it's not their fault, but I was just, don't tell me a week if it's gonna take a month. And then one day we call, and it's just like a nonchalant, like,
oh, it's benign. Don't worry.
I'm like, oh, okay, so that's good. So after my biopsy, I was scheduled for another ultrasound a year later, which was this past August. So it was like almost exactly a year from when I first found out. Went for my ultrasound. I was super nervous just because I was afraid of major growth, because it honestly would send me spiraling again. I was afraid to go anywhere, honestly, because just the thought of having a tumor in my neck, like just pressing down on my throat and my breathing, really made me feel really uneasy. Right after I found out it was benign and they're telling me you're gonna need surgery one day, COVID broke out, and I'm like, oh my God. This past August 2020, great time, I had my second ultrasound, which was just to see the growth, blah blah blah. I go to my follow-up appointment with my ENT after my ultrasound, it's usually like a month apart or so, and she tells me it's grown over 2 centimeters, which I think, if I have right, they do not want it growing over like 2 millimeters or something. I'm not sure. It's like very small. It's very minimal. So by the time I first found out about it, it was 4 centimeters. And then a year later, it was 6.1 centimeters. So it was growing very fast, way faster than they thought it would. So my ENT was basically like,
we want to do another biopsy if you want to, but at some point we're gonna have to take this out or you're not gonna be able to breathe.
So obviously I was very upset, because I was hoping for better news. I was hoping for anything but to hear that, because I had already gotten good news that it was benign, and now she was like, well, it's growing very fast, so it's kind of looking like it might be cancer. So we want to recheck if it actually is benign. And that's one thing they don't really tell you much, is that the larger it is, the higher chance you have of it being a false benign diagnosis. Is that they could have missed one spot that was cancer and then you're benign, but not really. The only way they can know for sure if it's benign or not, like 100%, you have to take it out and they have to biopsy the whole tumor, which is what I decided. So I was just like, please just take it out, because I cannot take this anymore. Like, I have not felt like me for so long. I honestly cannot take this anymore. I cannot go through more months and months of, is it benign or not? I just can't. I was just so excited to just get it out. So yeah, with my ENT, she basically was like, okay, we'll set you up for surgery. I'll refer you to the surgeon that I work with. She's amazing, blah, blah, blah. And so I was referred to my surgeon. I met with her, and it was a month or two later. It's kind of all foggy for me because I was just like, please, I need to make this happen. I need to get this out of me, please. So I met with her. I got a CT scan. She wanted to see, you know, where all my important parts are so she can avoid it. And she basically described to me the CT scan is basically like a roadmap for her. That was pretty easy. I was scared for that too. I was scared for every part of this whole thing. They just inject this contrast into you. It does not hurt at all. It kind of makes you feel like you're peeing your pants, but that's about it. It makes you feel really warm, which is kind of alarming, but they do warn you, like, you're gonna feel like you're having a hot flash, or you might feel like you're peeing your pants. It's different for everybody. That's so weird. But yeah, anyway, it was fast and easy, and they said, you know, just to drink a lot of water and blah blah blah, it'll be out of your system in 24 hours. So I got that done. I went to another appointment following up my CT scan with my surgeon again. Basically that appointment was super fast.
Everything looks great, like, we're good to go, let's schedule your surgery.
I was scheduled for November 4th at 8 in the morning, I think. I had to be there at 6, but yeah. Basically, the time I found out the date until the day happened, I was so scared. And I had it done. It was super easy. I was actually really nervous to be put to sleep because I've never been put to sleep before. I always hear these stories of like, oh, we're gonna count down from 100, and then like they get to 96 and they're out. They didn't tell me to count to nothing. Like, I was freaking out. I was like starting to hyperventilate. Trust me when I say, if they know you're the type of person to freak out, they do not give you time to freak out. Because the time I was like, oh, I'm feeling really scared, they're like,
you ready for your cocktail?
and I was like, yeah. And then that's all I remember. Literally, like, I was about to peak, freak out, and that was it. I was out. Like, I just remember waking up. I did react to the anesthesia a little bit. I just got a little sick. I was just a little pukey for like 2 or 3 hours after the surgery, which really hurt. It really hurt. The most painful part, honestly, for me was the breathing tube. It caused a lot of chest pain for me, just breathing in normally. It stung really bad. I couldn't take a deep breath. It would burn. But they said that was normal. I'm sorry for the sirens. I live like right by a fire station, and I live in a very small town, so there's only one road that they can go through. So I didn't really have much pain, honestly, but they did have me on Norco for the one night I was in there, because I did have to stay the night just for observation. I didn't have a draining tube or anything. It's like, I recommend getting a neck pillow. That was a lifesaver for me the first few days. By like 4 or 5 days, I was feeling pretty normal. I started like sleeping flat. It's a pretty quick like healing experience. You leave the hospital with this, I did anyway, with this big bandage. It literally covered my whole chest all the way up here. That was also very uncomfortable to sleep because you couldn't do anything because there's just this big like padded bandage all across your neck. Like you can't like look to the side, anything, especially, you know, because of your cut. But it was like literally like the bandage too. It was like you have a cast on your neck. I took that off the day after I came home, I think. I felt so much better because then after that you just have a little steri strip that's just covering your incision, and then, you know, you're able to shower finally. Felt normal in a week or so. Was doing everything, cleaning the house, you know, doing whatever. That brings us to here. I have my blood work scheduled for Monday to see if everything's working okay or if I need medicine. But honestly, I have not felt so good in so long. The scar does not bother me whatsoever. It's better than having a big huge lump in your neck. My tumor, I do not know how to pronounce it, so I will put it here. This is what I had, but it did end up being benign. So I hope you enjoyed the video. I don't think I missed anything, but if I did, you're welcome to ask me any questions in the comments below and I will gladly answer. But yeah, that's about it. I want to thank you guys for watching and listening to me cry about my small problems, but you know, they were problems to me and that's what matters, and I just wanted to talk about it, and I wanted to come back because I love making YouTube videos, and I'll see you guys next time, hopefully soon.